It is 11 minutes past 8. So junior doctors are to stage a 4-day walkout in April to fight for their right to get a 35% pay rise. It comes just days after leaders of the British Medical Association met Health Secretary Steve Barclay, who said the pay demand is unaffordable. So, what would Labour do? Well, we're joined by Shadow Health and Social Care Secretary Wes Streeting. We know that the government listens to you in particular, and actually, it's been argued on this case, listens to Labour quite a lot in some of its suggestions for how things go. And it's been suggested that the increase in the cap, or the removal of the cap on pensions, the money you can put in, was your idea in the first place. But, of course, you meant it just for doctors, didn't you, to help that situation? So what are you proposing now that they might pick up on?
Yeah, thanks, Kate. You're right to say that I wanted a specific scheme for doctors, which probably would have cost about a tenth of the £1 billion tax giveaway the government's given to the wealthiest at the same time as everyone else's taxes going up next month, which is why I think it's particularly unfair. But in terms of the junior doctors dispute, this news of another round of strikes is really bad news for patients. The NHS always has a bit of a pinch point post-Easter bank holiday weekend. So to have strike action on top, I think, is a real risk to patient safety. I think what the government needs to do now to avert strike action is to get around the table with junior doctors, hear what they've said yesterday. Their 35% headline pay demand, they've said, is a starting point. I think it's encouraging that the BMA have recognised that they've got to be willing to compromise, that 35% is not achievable overnight.
So where would your compromise be? Steve Barclay has said 35% is unreasonable. What is reasonable to you?
Well, I don't expect Steve Barclay to sort of come on air and do a sort of live negotiation or pluck numbers out of the air. I'm not going to do that either. But I do think one of the reasons we didn't have these strikes under the last Labour government, in national strikes in the NHS, is because we paid people fairly. We actually managed to deliver the pay restoration that the BMA is calling for. It took us time, and that's one of the things I've said to the BMA, actually. I said, look, I can't do 35% overnight if I was in government today, but what we've got to do is get the economy growing again so that we can invest in our public services and pay people fairly. The Tories will argue, of course, the Tories will argue that over the course of the last 13 years that they've been in government, firstly, we've had to sort out the situation from the banking crisis that we were just talking about. They've gone through all sorts of austerity issues. We've had the pandemic, we've got the war. You know, there are reasons why they've not been able to deliver the pay increase that they would undoubtedly want to deliver, the junior doctors and lots of those frontline workers. Ben, I don't doubt that factors like the war in Ukraine have made things more difficult. The pandemic is something that every government around the world has had to contend with too. But that doesn't explain why we've had 13 years of low growth, low productivity, wages not keeping up with the cost of living. Because if the Tories had kept growth at the same level that the last Labour government did, there would be about £40 billion more to spend on public services without having to put anyone's taxes up. So that's the cost of that we're all facing as a country of 13 years of low growth with the Conservatives. It's high taxes, low wages, low productivity, high inflation. Thanks to their mini budget, we're all going to be paying a lot more for our mortgages this year, those of us who are on mortgages and worried about our prices going up, as I am. So I think that those factors you mentioned are what I would kind of call facts in mitigation, but they're not excuses for where the Conservatives have got our economy to.
Can we ask you a question that was brought up by Dr Amir, was on the show, Dr Amir Khan, who's one of our GPs that comes in and offers advice.
I hope it's not a question about the train toilets.
It's not, no.
I was horrified.
Mate, if you could fix the locks on the train toilets, we might come to that.
No, absolutely. I do have a story, and no, I'm not sharing it.
We are now very intrigued. But can we ask you the question? So what Amir was talking to us is that one of the things that Labour has said is they want to train up thousands more medical students. They want to find these medical student places, which is very laudable. All of us understand that we need more doctors and we want to retain those doctors once we've got them as well. But the training and finding places for those students is really, really important, and that's the tricky detail. I'm just going to play you the question that he wanted us to put to you, if I may, and then we'll get your response. Here's the question.
When you talk about increasing the number of medical school places, it isn't just a case of expanding medical schools. You've got to remember that these students have to go into hospitals and GP surgeries. A lot of these places are already saturated with students. And if you're going to offer new places, you've got to train up clinicians to teach if you want to offer a good teaching experience for students. So when you do talk to Wes Streeting, please ask him how he's going to train up new hospitals and GP surgeries to offer placements to these medical students, because that's where the detail really lies, and that's often where things become unstuck.
So the saturation of the situation at the minute is the problem for training up these students. Where are the spaces going to come so we can get these thousands of extra students?
To train them.
Yeah, Amir's right to raise the issue. I think there are a couple of things here. One is that our modelling was based on some work done by the Royal College of Physicians. So we've been listening to professionals, and we set our stall out on expanding training places this far out from an election, so that we've got time to work with universities and work with NHS employers to make sure we've got capacity. I think there's something we can do around bringing people back to the NHS who've left in recent years because of the state of the system and because of the way they've been treated. I think encouraging some of those people to come back and help with training, I think, is part of the answer. The other thing I'd say, and this goes back to the junior doctors dispute, one of the big anxieties I'm hearing from junior doctors is that there is fierce competition for specialist places, specialist jobs in the health service. And I know that there are lots of junior doctors who are nervous about bringing more people in. Would that increase competition for their places? So I think there's a bottleneck there to get more, once we get people through medical school, once they've done their time as a junior doctor, to get them into the specialist roles we need, so that we can bring down things like cancer rates, so that we can get better specialist support in areas where the NHS is currently falling well short of European standards and where we'd want the NHS to be. That's why Labour's working in a really detailed way through these plans, so that we can hit the ground running on day one and give patients and staff in the NHS confidence that there's some light at the end of the tunnel when we see so much misery on our TV screens every day, because the NHS is really struggling to cope. And that, I don't blame the NHS staff. I do blame 13 years of mismanagement. And Labour's got a great track record on the NHS, which is why I think people can trust us to make sure that we've got an NHS that's fit for the future.
Well, you've used up all your time. I know you're a busy man. You've got to go, so you got away without telling us that story. But we'll have you back and we'll talk some more again. Good to speak to you this morning.
Cheers. Thank you, Wes.